Let me come to you, Dr. Kilani, first. What exactly is happening to our bodies when these microplastics enter? I was watching a report by NYT earlier this week where they said that even when they were picking up breast milk samples, they were picking up placenta samples, they were picking up a lot of other things, the discussion, the person who was doing the entire detailed report said now it's a given that microplastics are going to be found in each part of our body. So should we be scared, should we be worried, what is the way to limit this?
So, Sonal, we are actually terrified, not scared, but it's nothing new that we did not know. This study is an eye opener, but we always knew that plastics in city of Delhi and all over would be causing havoc. Unlike the air pollution, which leads to immediate sore throat, coughs, smarting of eyes, asthmatics will have attacks, they'll come to the emergency, there'll be more ICU admission, more ventilator. Particles will act slowly, actually. And this is absolutely man-made, absolutely man-made, and you have already shown in your reports. It does enter through the lung as well as in the gastrointestinal tract, because what we eat, what we drink, don't we find utensils saying they are micro safe? They are plastic things. Just because it's written in the micro safe, we conveniently heat our food. That's only a simple thing. Don't worry, we are we not drinking water in the plastic bottle, thinking that we are having a safe water. And what about buying vegetables and all those things in a plastic, polythene bags? Where do they go ultimately? Ultimately, they go into our water, they go into our food, they go into our agriculture. What it does to us, something are known, something is not known. We know that it causes
Okay, let's quickly fix that line with Dr. Kilani. Let me go to Vimlendu Jha then. Vimlendu, the discussion on air pollution has become the discussion on plastic. Who would have thought that this day would come? But here we are discussing how plastic, every piece of it, is now responsible for our bodily health or our physical health as well. Are you surprised at all by this study, or this is something that has been spoken about?
So, Sonal, I think there's been several studies on this. Of course, this one is very specific to Delhi, and therefore it's very, very alarming. And also the reason because Delhi already is a toxic city in that sense. It's a city that already has such alarming levels of air pollution. And all this while there were these studies that were actually done in London and Paris, which relatively, or perhaps in is much better than the data points that we actually have vis-a-vis air pollution of Delhi. Also, all this while, every time we spoke about microplastic, largely we were talking about marine litter. We were actually talking about our waterways getting contaminated by microplastic and therefore our entire food chain in that sense. This, in many ways, is for the first time asking us those difficult questions that all this while, if you were thinking that it's only dust that is responsible for almost 30% of your air pollution, or perhaps vehicular emissions, which is responsible for almost 40 to 50% of the air pollution. Imagine if there's so much of garbage all around. And by the way, Sonal, this study was done in this area called Lodhi Road. And all the data points have actually come from one of the cleanest areas of Delhi. Yes. Imagine if a study like this was actually done in Anand Vihar, or perhaps in Bhalaswa, or in some other neighborhood, which was not as posh, as rich, as maintained, as plastic-free, or plastic sore-free as Lodhi Road in that sense. So it's almost a great study, of course, but imagine reality of this study that we're talking about. But the main point for all of us here is that when we know that there's a study almost which has a government stamp or an academic stamp, also say, for example, an Indian educational research study, because all this fine, if it was a Lancet or someone else telling us, then we thought that this was perhaps an international propaganda to shame Delhi in that sense. Here we have our own researchers and scientists and the scientist community telling us that our air actually has microplastic, and air of Lodhi Road has microplastic, and through the year, and not just in winter in that sense. And interestingly, this study also talks about the fact that most of this transmission, this microplastic, or the reason why microplastic is able to go from point A to point B is because it carries largely through dust particles and of course through other vehicular emissions and other things. Now, therefore, what are the action points? What are the key takeaways?
Just hold on to that. Just hold on to that, Mr. Jha, because I want to, when it comes to plastic, the conversation is not an easy one. While you were speaking, we were running graphics of what constitutes to microplastics. And I'll request my producers to play that graphic up again, and it'll tell you the composition that the study also said. It said about 40% of it was coming in from polyester and the rest of the stuff, right? Now, these are in your clothes, these are in your bags, these are in the curtains that you put in your house, these are in the bottles that you use in your tiffin. Once you start looking at those figures, it feels as if this is a lost cause. It feels as if there is just no way in which we can escape it.
No, we should, because there's a difference between indoor microplastic or indoor air contamination and outdoor air contamination. So a lot of things, the clothes that we actually wear, and the microplastic that it carries versus and the food that we eat is one thing. But right now, most alarming, the data that we're talking about is transmission through wind or transmission due to heat. And a lot of that is attributed to outdoor this thing. So at the end of the day, when we talk about who has to therefore stop this menace, where does it actually stop and what are those action points? It has to be somewhere. First of all, do we even measure it in our country in terms of our air quality indicators or air quality monitors that we actually have in Delhi? And Delhi has the most amount of air quality monitors, and other towns don't even have so-called landfill management, or in fact, many cities don't even have a landfill. Imagine the plight of microplastic or open burning of plastic and contamination of our waterways and our airways in that sense. So it's a very grim situation. I think one of the first things that we need to do is that make microplastic, like right now, we look at PM 2.5 and PM 10, and only these two parameters as main parameters of air quality measurement or / assessment. And therefore we will, and by the way, there's PM 2.5 is too big a particulate matter that we talk about. Globally,
this is PM1.
Things have evolved to 0.5 to 0.25 in that sense. Because, at the end of the day, PM10 is big, PM2 is smaller, and PM 0.5 and 0.25. And here we're talking about microplastic, which is 5 mm and 0.5 mm and lesser, and nanoplastic. Like right now, we talk about microplastic, and there's something called nanoplastic also, and this is one study. And therefore, what does the government of our day derive out of this study is very, very important, both from an environment point of view and public health point of view. I'm sure Dr. Saab will tell you, and Dr. Saab has been talking about the impact of air pollution on our children and the elderly. But it's the air pollution impact is a composite of, when we say, why does cancer occur because of lung infection or air pollution, is primarily because of a lot of these toxins, which are not even measured / assessed by our air quality monitors. And therefore, there's no air quality monitoring / and therefore mitigation regime that we have in the country.
Dr. Khilani, I don't think a lot of people even understand the concept of air pollution during summer and monsoon, which is why we're bringing out the story. People think abhi to bahut acha mausam ho raha hai, only till you get down to, like Vimlendu is saying, that A, it's not recorded, and B, then you ask yourself, why are there so many infections happening? Then you ask yourself why people are falling sick more frequently and for longer durations. Then you have to ask yourself questions like why in the summer people are breaking down. Then you have to ask yourself why so many people are having strokes, etc. Have you seen a direct relationship between air quality going bad and patients in your hospital across, say, gender and across age barrier? Is that something that you're seeing in your hospital?
Yeah, there is something called short-term effect and long-term effect. The short-term effect we see during the October, November, and December, when we have more patients with pneumonia, more patients with viral infection, more patients in the ICU, more patients on ventilator. But I want to bring another issue. Why 40% of the cancers or 50% of the lung cancers are occurring in non-smokers? Well, I was studying 95% of cancers used to occur only who used to smoke. Why there is the cancer registry of India shows that there are more cancers of the breast, more cancers of the female reproductive system. Why there is higher level of infertility? If you go into all these causes, the toxins in our blood and which goes through the air as well as to the food, Now, when we talk about plastics, it's not only the plastics. When the plastic is burned, there's a lot of
Yeah.
elements like zinc, aluminum, silicon, and thousands
All of
of
that is
toxic
becoming this
material
really
goes
toxic
into our
cocktail that all
system.
of us are constantly
It
sort of breathing in.
it affects our
Yeah.
endocrine system.
Yeah.
Don't we see 50% of our women are taking thyroxine, which was not there before, and this is everywhere, including the breast milk contains this toxin, including the plastic.
Yeah.
So there
Sir,
has
I
to
have
be a
last few
global.
minutes. I'm so sorry I'm interjecting. I have last few minutes and I really want to get some solutions from Vimlendu here. Vimlendu, like I said, I have my air purifier on in my house throughout the year now, but not everybody does that. In studios, in cars, etc., you can't live in or constantly with a mask on your face all year round. So what can a common man do, understanding fully well what is happening? Very quickly.
Sonal, two things, Sonal. One is we cannot never have private solution to a public problem. Don't look for a private solution for a public problem because you'll be doing great disservice to it, because that's what we've been doing. We've been, when our water got terrible, we actually fixed these ROs and things. When our air is bad, we're putting air purifiers. The other is it's a myth. You can't be walking with a cylinder of a clean air in a playground or in a cinema hall or on the road in that sense. I think it's high time that we have advocacy around it. We have those measures. And when we know that the sources of plastic, and we also know methods of safe disposal of plastic, when we so-called on paper already have a law banning single-use plastic, where the hell is this plastic coming from if there's a ban that exists on ground?
Yeah.